So what are the grand challenges of public health informatics? And this is a focus particularly on health informatics. Things that have been identified, and this comes out of the Minnesota Health eHealth Initiative on public health, who's done quite a bit of work in this area on a national basis. There were three major challenges that were identified in terms of health informatics for public health. One is the development of a nationwide public health data system. And they don't necessarily mean a nationalized database when they're doing this, but they are focusing on how do we better share health information on a national basis to address population health and public health issues. And the need for that, because as you, I think, are all well aware, public health problems don't recognize state borders, and that was underscored by the recent measles outbreak that started at Disneyland and has spread across multiple states, the Ebola outbreak that spread and touched many areas worldwide. So our public health agencies may know state borders, but public health and healthcare problems do not recognize state borders. The second major challenge is facilitating the improved exchange of information between public health and clinical care. This is, being able to take advantage more quickly of the health information, and how do we share, and what information and how do we make that available for public health use. And then the privacy, confidentiality, and security is pervasive in everything we do when we start sharing and collaborating with information, balancing the individual privacy and with the common good. And of course, that's covered by the HIPAA regulations, but some of the recent changes in HIPAA are really intended, which I don't think always come out, to really help facilitate this process of being able to get that balance of being able to take advantage of having better information available in a more timely way, but while still respecting the rights of patients and the privacy and security of health information, ensuring that the information as it's becomes available is used for the right purposes, and that we avoid negative uses of that information that could be harmful either to the healthcare system or to the individual patient. And so as we move forward, what I'd like to leave you with is what was identified in an article in JAMIA recently on Health 101 for informaticians, public health informaticians. A very interesting article, by the way, that you may be interested in looking at. The greatest challenge that they put out in the JAMIA article was applying information technology in unanticipated ways to re-engineer public health and invent new ways to protect and promote community health. And to quote them, they say, the application of information science and technology in public health practice provides previously unfathomed opportunities to improve the health of the population. And so when we come around back and you think back around those images of those horseless carriages with the engine replacing the horse, it's always easy to look back and see change and look at other people changing, but it's a lot harder when we start trying to think about changing ourselves and what we need to do to change. And so it's really, again, it's not about the technology, it's about using that technology and what that technology provides for us today as a platform for transforming healthcare. And we have to really remind ourselves that change is complex, it's messy, it's unrealistic to expect that we're going to get it all right the first time. It's going to take time. We're going to fail sometimes and have to learn from our failures and use that to better improve the things that we do the next time. And also, success is not a given. It's going to take a continued monumental effort. We've put $38 billion invested in this country in helping us make this transition to electronic health information. It's going to take probably double that to really get the full benefit of that. And so when our congressmen and senators start asking, and where are the results? We have to keep reinforcing that we've created the platform. We now need to make equally large an investment over the next 5 to 10 years in taking advantage and leveraging that platform. And this slide, to wrap up, is from Maine, and I give credit to the source, and you can see that when you look at the slides. But the idea is, to wrap us up, that technology is the platform, and the vision is making healthcare more patient-centric, of connecting the dots, of creating opportunities for sharing, collaborating, and using healthcare to gain better continuity of care across our system. And so that wraps us up. And we have just a couple minutes left for questions.